Have you ever heard the word bipolar disorder before? Well, some people say bipolar disorder is having a mood swing and a constant change between emotions. But I'm gonna tell you, it's more than that. Hi, I'm Laila, and today I'll be talking about bipolar disorder in depth. So what is bipolar disorder? Bipolar disorder is a mental disorder that causes a period of depression and a period of abnormally elevated mood. The emotions, mood, and energy level of someone that suffered from bipolar disorder move from extreme high to extreme low. These phases can last from days to weeks, and worse, if the person with bipolar disorder remains untreated, this episode can prolong for months. There are a few types of bipolar disorder. However, in this video, I'll be focusing on two types of bipolar disorder. Type 1, mania. People with bipolar disorder type 1 mania may experience an extreme high along with the lows. Type 1 have a major low that lasted for 2 weeks, followed by a major high that prolonged for a week. While type 2, known as hypomania, experience less extreme high, however, it infused with a long period of depression. To be diagnosed as bipolar type 2, the high episode need to last for at least 4 days. The symptoms of bipolar disorder. Manic episode or the extreme high, described as euphoric period that exceed beyond the regular feelings of happiness and joy. During a manic episode, individual can feel energetic, optimistic, and have high self-esteem. However, manic episode can generate a distressing symptoms like irritated or racing thoughts or impulsive action that eventually making a poor decisions, and last but not least, risky behavior. While hypomania symptoms in bipolar disorder is described as a less severe manic episode. Depression or feeling low, also another symptoms of bipolar disorder. Depressed episode exhibit in various senses such as feeling hopeless and worthless, having low energy, discouraged, and lack of focus, losing enthusiasm in life, eat and sleep more or less, and having thoughts of suicide. A person with bipolar disorder may experience a mixed episode that have both symptoms of depression and mania at the same time, or a rapid cycling where the person have 4 or more mania and depressive episodes in a year. A person with bipolar disorder might suffer from another disorder such as anxiety disorder, substance abuse disorder, ADHD, and personality disorder. Research and study shows that the causes of bipolar disorder is still unknown. However, there's few factors that we can consider as a cause to bipolar disorder. The biological causes. The ability of the brain to connect with neuron is disrupted. Hence, the brain's neuron create a network that is hard to navigate. With that, the brain gives out mixed and distorted signal. In comparison, a healthy brain able to develop a strong neuron connection. This is because the constant effort of healthy brain to connect and regulate the neurons, and it will discard unused and defective neural connection. During the extreme period of bipolar disorder, abnormal thoughts and behavior, including psychotic symptoms such as disorganized speech and behavior, paranoia, delusional thoughts, and hallucination can occur. This is due to the over-excessive of a neurotransmitter called dopamine. However, the data from the research show that the risk of having bipolar disorder is 10 times higher in the first degree relative with bipolar disorder. This is because the first degree relative share a similar DNA. First degree relative could either mean your parents or siblings. Environmental and trauma has become one of the crucial factors that cause bipolar disorder. The psychosocial aspect have a significant role in the occurrence and course of bipolar disorder. This is because trigger may occur during traumatic life event, interpersonal relationship, and in constant state of high stress. 30 to 50% of adults diagnosed with bipolar disorder have reported traumatic or abusive events during their childhood. Drugs and medication can also cause a bipolar disorder. This is because some drugs can trigger a manic episode, like SSRI. Another factor that can trigger an episode in bipolar disorder is when abuse of drugs and alcohol. So what are the treatments for bipolar disorder? By using mood stabilizer medication lithium, it can help by decreasing the abnormal activity in the brain, thus strengthening the viable neural connection. Lithium helps managing risky thoughts and behavior, and also is being used to prevent relapse and depression. However, mood stabilizer is only effective against manic episodes, and also is being used for a long-term treatment. Antipsychotic medication helps bipolar disorder patients by altering the effects of dopamine. It's also being used for a short-term treatment. An antidepressant medication helps manage a depressive episode. However, an antidepressant is not suitable for alone use itself, and is also not suitable for bipolar type 1. Have risk of accelerated cycling between phases. An anticonvulsant medicine stabilizes the way nerve impulses travel along the nerve cell and keeping the nerve impulses stable and normal. With anticonvulsant medication, nerve impulses don't become excessive and uncontrollable. Other than medication, electroconvulsive therapy (ECT) also helps people with bipolar disorder. Electroconvulsive therapy works by allowing small electric current trigger changes in brain chemistry to reverse symptoms of a certain mental health disorder. Sometimes, ECT is being used as an emergency treatment. For example, a pregnant lady with a bipolar disorder may not be able to take in some medicine. Hence, the doctor will suggest to try ECT therapy. Psychotherapy aims to help a person with bipolar disorder. Psychotherapy helps the patient to accept an understanding of their own diagnosis, help the patient coping with stress, improve their interpersonal relationship, help the patient to recognize their symptoms, and prevent relapse. Without treatment, episodes become frequent, intense, and take longer time to subside. Even though access to medicine and therapy is considered as a privilege that not everyone with mental health can afford it, however, a simple changes in routine and habit can give benefit to a person that suffers from mental disorder, such as exercise regularly, a good sleeping habit, sober from drugs and alcohol, and last but not least, acceptance and empathy from family and friends. A person with bipolar disorder constantly fluctuates between emotional states. It can feel difficult to find the equilibrium necessary to lead a healthy life. People with bipolar disorder empower themselves to find balance in their life.